You have an electric toothbrush, you have a Sonicare, right? The main difference between a Sonicare and the Oral-B's are the heads. So an Oral-B has a little round head, Sonicare has a little bit of a longer head, and you want to let the brush do all the work for you. So you don't want to, and I'm going to pretend with this one because it has the Sonicare head, you don't want to manually do the circles. So you want to treat your teeth like as if it's the only tooth you have in your mouth. So if you're brushing and you go from one tooth to the next, these in-between parts will get missed, and that's where we typically see higher readings when you're checking your perio pockets. So your teeth have three surfaces. You got the back side, the cheek side, and the inside. So this brush is doing all the work for you, and what you're gonna focus on is hugging your teeth. So it's kind of like a pivot, or like you're pulsating back and forth to get all those surfaces. Because if you just cruise along, those spots will get missed. Whatever you do to the outside, you always want to do to the inside. And then back here is a tricky spot. Sometimes the brush will not touch completely, so just flip it around and use the very tip of the brush. The only place that's okay to scrub is on the chewing surface, but again, if you just let the toothbrush do the work for you, that's good. And then with flossing, do you use manual, like traditional floss, or flosser, like these? These ones. Okay. When you're flossing, you want to be careful, gentle seesaw back and forth. If you kind of just bounce back and forth where the floss lands, that can create a gum slit, which is a place where plaque and bacteria can hide. So once you gently get it between, you want to pull back on your flosser so the floss is kind of making, it's not completely straight, it's making a C shape on your tooth, and then slide it down. You don't have to worry about how far down you're going because your gum will stop. So you really want to make sure that you're pulling and then slide down. Since you're in here, you can cut across to this side and do this side as well. Just slide it down, and you can get two teeth at one time. Traditional floss is nice, but anything that you use, flossers, there's even water picks out there, anything that will encourage flossing is good for your gums. Toothbrush is going to clean your tooth surface, the gum is going to clean a little bit more where the toothbrush can't reach at. And then the last thing is a tongue cleaner. So you can clean your tongue with a toothbrush, but sometimes it kind of just flares everything up. With a tongue cleaner, in one swipe, so you want to go as far back as you can and just swipe it all out. All this stuff you can find at any store that you buy your stuff, or your hygiene stuff at. When you're looking for a tongue cleaner, be sure that it's metal because there's a lot of plastic ones out there. Those harbor bacteria and they break. This is a once in a lifetime purchase. You just buy it once and that's it. Any questions? And 2 times a day, brushing and flossing. Flossing once a day, brushing twice a day. Okay, sound good? Awesome, thank you.